Well, Libby, you mentioned kind of getting back together in person sometime soon at the December meeting. On that note, the board accepted $660,000 in state funding to help with COVID vaccine distribution right here in Arlington. It really, underscores the hope that we all feel that we'll be able to eventually vanquish this pandemic. Now, what is the county's plan for vaccine distribution as we get into 2021?
Well, I would say the plan as we speak is changing in a way because we have to follow what the state and the federal government is doing and the vaccines that we get and where we get them. At this point, I think we're expecting 480,000 doses in the state. We're going to be following the same priority order, which is, our frontline health workers and our older folks, particularly in facilities, long-term care facilities first. So we're rolling it out, and it's going to be a little slow, but we're starting by the end of this month, by the end of December, a few days, we should really be cooking. But a lot will depend on outside forces over which we don't have much control. We have been planning, I know our health officials have been planning for a long time. Dr. Ruben Varghese is actually on the state workforce that's been trying to plan for distribution. So, and then, as I think we've explained in our work sessions, and, we've got another one coming up, where we can kind of update people and get updated ourselves. There are two different kind of vaccines. One of them has to be kept at like minus 94 degrees. That's just incredibly cold and hard to handle. The next one doesn't need as careful care. Everything needs to be both Moderna and the Pfizer vaccines. You have to get 2 doses. I think one is 21 days apart. The other is 28 days apart. You got to keep track of that. So there's a lot of organization to do. So I think we're starting out a little bit slowly to make sure we get it. But the whole point is to take it to scale as fast as we can. But it's going to be a number of months, and then I'll let Christian add what he'd want. But I think the message, which we maybe will give several times right now in this particular wrap up, we're not done yet. There is light at the end of the tunnel. But everybody's still got to, wash the hands. Yeah, that's always good. Wear that face mask if you're out. Stay distanced. Stay at home. We just have a little more of this to go. It'd be so sad for somebody to be the last person to get sick with COVID before the vaccine, right? So we really need to be working on that. So plans are constantly changing, which is why we've got stuff on the website for people to watch. But they should be able to get it from, their doctors and the pharmacies. There are going to be various distribution points once they get kind of worked out. Christian.
Yeah, to some degree, we're all experiencing pandemic fatigue. And, in some cases, the approval, the emergency use authorization of the Pfizer vaccine, soon to be Moderna, perhaps sometime in the spring, we will have another vaccine option available. This gives us great hope. But as Libby said, it means that we have to redouble our efforts in the practical hygiene standards and the mask wearing and the physical distancing that have become a part of our norm for the better part of this year. We actually have to double down on that because this coincides with the easiest period for the virus to transmit, given that we're spending so much time indoors. And if we don't practice those other necessities of pandemic management, we are going to have situations that we've seen over the past month with rising caseloads, rising death counts, and these effects requiring greater degrees of restrictions on the part of state authorities. So we have to have everyone continuing to do their part, and then we'll have to hopefully have the availability of vaccine come in such a way where we can push it out to all of the necessary groups as quickly as possible. As Libby said, this information will change, if not daily, quite frequently. So we encourage everyone to follow our website with all of the latest information. And one thing I would also say is that when it is your turn and vaccine is available, be sure that you are planning to be in one place to receive both doses of the vaccine, if that's if you are eligible for one that requires 2 steps, because it's going to be a lot easier to track and maintain if you go to the same service provider to get both of your doses.
Yeah, I think we can't emphasize enough to everybody to be safe, and also we can't answer too many specifics now because the way things are changing. By the time this actually gets broadcast, information will have changed. So The basics are the same, and when you can get the vaccine, get it. I think you will see a lot of elected officials and other notable people getting public vaccines. I think probably people will never have seen so many people getting vaccinated because we really want everybody to get this vaccine and not be worried about it.